from the local station, the morning show starts now. All right, maybe you are one of the millions who suffer from blurred vision. It gets worse as you age. And a new FDA-approved eye drop could replace your reading glasses in as little as 15 minutes. It's called Vuity. Joining us this morning to talk more about this, what it could mean for people dealing with eyesight problems, is Dr. Gulani with the Gulani Institute of Jacksonville. Good to see you, Dr. Gulani. How are you?
Good morning, Vic. Thank you for having me.
Absolutely. So, listen, you are an eye surgeon, and people come from all over the world for surgeries from you, but there is a way that some people can avoid that, according to people that make this new eye drop.
Correct. This approval, the recent FDA approval of Vuity drops, is actually very exciting because it does three things. One, it's addressing perhaps the most frustrating issue that people face as they age. Reading glasses, you know, those pesky little cheetahs that are needed to read the menu, to see your cell phone, to basically see things up close. And the second important reason this is exciting is it is the only non-surgical approach to helping people who are now need reading glasses and are very frustrated. It's non-surgical, though temporary. The third very important reason, which is exactly what I'm teaching today in Hawaii and tomorrow in California, is the permanent solutions like surgical techniques like LaZrPlastique or LaZrPlastique that I perform to help people get out of reading glasses. This could be the transit or the bridge where patients can first use these drops to see how much their reading vision is affected and how it would be if it was corrected. So that's very, very exciting times today for addressing perhaps what affects millions of people as everybody ages beyond 40.
Yeah, so certainly it's something that you can just start, see if it works for you, and if not, you go and see a doctor. Do you need a prescription? Do you need to go and see someone like you before you're able to get this?
Absolutely. Like everything else, I say, first make sure your eye doctor sees you, you are properly measured to make sure there's no pathology, and yes, it does need a prescription. And it's basically a drop that acts within 5 minutes or 15 minutes in some people and lasts for about 6 hours. So patients can literally take it before any event, social event, or important official event, and really get about their lives. It may not help reading all the way, but it helps people stay away from reading glasses for most of the time, for most functions. And like I said, it could be a bridge before they decide for permanent surgical correction for reading glasses.
A lot of people are always concerned about cost when it comes to medical bills. What would this cost your average patient?
On average, though it's early times right now to see the exact cost, it can range anywhere from $60 to $80 to $100 for a month's supply. And again, patients can just use it as a reversible technique by putting the drop in a few minutes before they need to get to their task.
So certainly. So are there any cons to this treatment?
Yes, and very, very, very low levels of side effects in the study that was FDA approved. Some people had redness, some people had headaches. Actually, think about it, it's very funny. This drop actually contains a chemical that's over a century old and basically decreases the size of our pupil like a camera. Once you decrease the aperture size, as you know, the focus or the depth or range of focus increases, and that's the trick where the mind can start seeing things up close better, even though there is still presbyopia or need for reading glasses.
Yeah, I know that we've had many conversations, and you always say that the future is bright with modern medicine, with surgeries that are less and less invasive. Well, you know, what is the future for people that are having vision problems?
So the future is very bright, and this again accelerates it because reading vision is a very big issue for millions, over 30 million people in the US and all over the world. Actually, surgical techniques are much more confirmed now, like the ones that I provide, like LaZrPlastique, which is a non-cut technique, or LensoPlastique, where we use new generation lens implants, which may be bifocal, trifocal, multifocal, progressive, and they're put inside the eye permanently, so you don't need reading glasses. But this again becomes a non-surgical option for patients to initially try and get about their lives and also see how much the reading vision is impacting their lifestyles.
All right, Dr. Gulani, as always, thank you for coming on. Thank you for breaking down this, important topic right here. And the long story short for everybody at home is, if in doubt, if you have questions, go see a doctor. We'll be right back.
Absolutely.